Medicare Advantage enrollments have been skyrocketing over the past several years, and plans are offering more extra benefits than ever before.
Extra benefits.
But are these trends about to see a very dramatic shift? With over 50% of beneficiaries now enrolled in a Medicare Advantage plan, impacts to these plans will affect more people than ever before. Recent headlines have been buzzing with news about potential funding cuts, benefit reductions, and more for Medicare Advantage plans starting next year in 2025. In this video, we are going to take the time to separate fact from fiction and dive deeper past these headlines to uncover what is really happening to the Medicare Advantage plans going into next year. We'll explore the changes, what insurance companies are saying, and most importantly, what does this mean for you, the Medicare enrollee? As a reminder, my name is Cameron Giardini, and I help operate our Medicare-focused insurance agency called Giardini Medicare. If you want to connect with one of our agents, you can do this by going to doineedmedicare.com, or you can visit our main website, gmedicareteam.com, to schedule a call. Or if you simply want nothing to do with us, all we ask is that you like this video and subscribe to our channel for more. To understand the major changes coming in 2025, we have to take a quick step back and first understand how Medicare Advantage plans receive their funding from the federal government in the first place. Medicare Advantage plans, often called Part C, are alternatives to original Medicare offered by private insurance companies who contract with the federal government. These plans, they cover Medicare Part A and Part B services, except for hospice, and they often include additional benefits like dental, vision, prescription drug coverage, all in one bundled plan. We often get asked, how do these Medicare Advantage plans have $0 monthly premiums and still make money and operate? Well, essentially, Medicare Advantage plans, they receive a fixed monthly payment from the federal government for each person that enrolls in the plan. Now, I am not an actuary, and despite years of researching this, I think it's truly impossible to fully comprehend all of the complexities of Medicare Advantage funding, so we will link to more detailed sources in the video description if you want to go down that rabbit hole. But for now, we will stick to a more general overview and behind-the-scenes look of Medicare Advantage plans. The first term you need to know when we look at this are benchmarks. The federal government and Medicare sets benchmarks in each county across the country. These benchmarks are determined by Medicare using the average fee-for-service Medicare spending adjusted for geography and demographics. Simply speaking, the benchmark represents the amount Medicare expects to spend on an average beneficiary in a specific area if they were to have original Medicare and not a Medicare Advantage plan. For those of you interested, we will include a link to the actual national benchmark rates for 2025 in the description of this video, but for simplicity's sake, let's just assume that benchmarks are about $1,000 per month in each county. Now, this benchmark amount, it is not what Medicare Advantage insurance companies collect from the federal government. Instead, each Medicare Advantage company submits a bid reflecting the plan's estimated cost of providing Medicare Part A and Part B services to an average beneficiary that enrolls in their plan. These bids, they must be submitted by the first Monday in June of each year, and they include the estimated cost for medical services, administrative expenses, and profits. Importantly, administrative expenses and profits cannot exceed 15% of the total plan's revenue, which ensures that at least 85% of revenue is directed towards member benefits. This 85% is considered their mandatory minimum for their medical loss ratio. To continue with our example, let's assume Medicare Advantage plans are submitting bids of $900 per month. In a simple world, the government would then pay the Medicare Advantage plan $900 based on their bid, and the government would save money since this is below the benchmark. However, this is not a simple world, as we all know. Instead, benchmarks are adjusted based on factors like risk scores, star ratings, and more. Insurance companies then receive rebates based on the difference between the bid and the benchmark amount, which they can use to provide extra benefits not covered by original Medicare. For example, a plan with a 4-star rating or higher can receive a quality bonus payment of 5 or 10% depending on the county. Plans also receive higher percentages of their rebate amounts based on their star ratings. You can see the different rebate percentages here on the screen. According to MedPAC, nearly 3/4 of Medicare Advantage enrollees were enrolled in a plan receiving these quality bonus payments. In 2024, the bonus payments just from star ratings will result in $15 billion in additional Medicare program spending. Now let's finish this with an example to wrap this whole funding concept together, and then we'll talk about all of the changes changes impacting this in 2025. For this example, let's compare two fictional plans. We have Company A 3-star rated plan, and Company B with a 4.5-star rated plan. Both are in a county with a $1,000 benchmark, and both submit a $900 bid. Company A with 3 stars would not receive a quality bonus payment, and they would receive 50% of the $100 difference between the $1,000 benchmark and the $900 bid, amounting to a rebate amount of $50 per month. Now, on the other hand, we have Company B, that again is a 4.5-star rated plan. They would receive a quality bonus payment, adjusting their benchmark by an extra 5 to 10%, but we'll just stick with the 5% in this case, which would create a total benchmark of $1,050. Now, the difference between the bid and the adjusted benchmark is now $150, and due to the higher star ratings, Company B would be able to get 70% of this difference as a rebate. This would be $105 per month for their total rebate. So, despite the same initial benchmark and the same bid, Company B now receives more than double the rebate amount of Company A. These higher rebates allow Company B to offer more robust extra benefits and potentially lowering the out-of-pocket cost for you, the member. According to MedPAC, the average Medicare Advantage enrollee is enrolled in a plan receiving an annual rebate of $2,329 for the year, which results in $2,142 worth of extra benefits. These rebates, they are a significant factor in making these Medicare Advantage plans attractive to many beneficiaries, as they enhance the value of the plan without increasing out-of-pocket expenses for you, the member. The ability to offer substantial extra benefits while maintaining low or zero premiums is one of the key reasons why Medicare Advantage plans have seen such rapid growth in enrollment in the past several years. Lastly, there are two things I want to leave you with before we move on to those 2025 changes. First, when Medicare Advantage plans receive their yearly payments from the government, they are considered capitated or fixed. This means that once insurance companies receive their full payments, they can't ask for more if they underestimated the cost. You'll see why this matters very soon. Also, Medicare Advantage plans have failed in their original focus for saving the government money.
That's not surprising.
According to MedPAC and their report, the Medicare system spends $83 billion, or 22% more for Medicare Advantage enrollees than they would if these same enrollees were instead with original Medicare. Now, just keep that in mind as we talk about these upcoming changes for 2024. First, as we discussed in our previous video, the Inflation Reduction Act has introduced significant changes to Part D prescription coverage in 2025. This includes a $2,000 cap on out-of-pocket drug spending for plan members, meaning that once a beneficiary's total spending on drugs reaches $2,000, they would not have to pay more out-of-pocket for those covered medications for the rest of the year. Additionally, the Act introduced a new prescription payment plan, which allows beneficiaries to spread their medication cost into monthly payments to make things more manageable when they are paying their expenses. But this also puts more financial and administrative burden on insurance companies. The new cap on out-of-pocket drug spending also will shift a greater share of the cost burden onto the insurance companies themselves. In addition to the $2,000 cap, under the new regulations, plans will be responsible for 60% of the cost of medications in the catastrophic phase of coverage, compared to just 20% in 2024. These changes will place increased financial pressure on Medicare Advantage plans, since they do often bundle medical and prescription drug coverage all in one plan. However, Medicare Advantage plans, they have a distinct advantage over standalone Part D plans. The advantage that Medicare Advantage has in this case is due to all of the rebates that we discussed earlier, and that's why we wanted to go into that in more detail. According to KFF, Medicare Advantage plans, they can keep their premiums, including prescription drug coverage, lower than Part D plans because they can use some of their rebate dollars to lower their Part D premiums built into the Medicare Advantage plan. For example, if the changes from the Inflation Reduction Act would normally make a Medicare Advantage plan have to increase their premiums by $30 per month, instead they could use $30 of their rebate dollars to keep their premiums from rising. Now, although this would reduce the amount they can use for extra benefits that they can provide, it does help Advantage plans keep $0 per month premiums that they're famous for. In fact, MedPAC, they report in 2024, Medicare Advantage plans with prescription drug coverage are using $47 per month of their rebate dollars to lower their Part D premiums, and this could certainly increase going into next year. In addition to changes from the Inflation Reduction Act, recent studies show that medical expenses per member in Medicare Advantage plans were at least 7% higher in 2023 compared to 2022. This trend also continued into 2024, with more beneficiaries using their plan benefits, especially for outpatient services, inpatient admissions, and extra benefits like dental coverage. However, not all companies have had higher than expected utilization, with United Healthcare reporting that they have avoided utilization pressures in the first part of 2024. When usage like this increases, though, for other plans, it does cut into plan profits, as their fixed monthly payment amount does not adjust throughout the year to accommodate these higher than expected costs. We do not say this so you have pity for insurance companies, since of course you shouldn't, but this does impact your Medicare Advantage coverage. If usage remains high, plans will have to increase their bid amount to compensate. This goes back to our payment example from earlier. This would reduce both rebates and extra benefits they can provide to you, the member. Lastly, going into 2025, Medicare Advantage companies, they feel that their payments from the government are not high enough to cover all of these added costs. CMS did announce a 2.33% increase in benchmarks for 2025, but some have argued that this is not sufficient to cover growing healthcare costs. AHIP is an organization representing health insurance providers, and they have voiced strong objections to these benchmark changes. AHIP states that the benchmark adjustment does not reflect the more than 7% increase in utilization reported in recent studies. This discrepancy means that while the benchmarks are rising modestly, the actual costs incurred by Medicare Advantage plans due to higher utilization rates are increasing much faster. AHIP argues that without more substantial increases in benchmarks, Medicare Advantage plans will struggle to maintain their current level of benefits and coverage, potentially leading to the reductions in services or higher costs for you, the beneficiary. However, keep in mind that CMS is still projecting an overall increase to Medicare Advantage plans going into 2025, which would be an additional 3.7%, and they say that this would increase overall spending by $16 billion. Also, make sure you take these doom and gloom headlines about rate cuts with a grain of salt, since we saw these identical headlines in 2023, only for 2024 Medicare Advantage plans to have stronger coverage than ever before. So enough about what's happening in 2025, what are insurance companies themselves saying? We will discuss that now, but first, please do us a favor and tell us in the comments which topics you want us to cover further in future videos, as well as what you think will happen to Medicare Advantage plans in 2025. Luckily, we don't have to guess what insurance companies are thinking about these upcoming 2025 Medicare Advantage changes. Because many of them are publicly traded companies, we can hear their exact thoughts on the matter from their earnings calls with investors. We will link to the full transcripts down below in the video description, but we analyzed the earnings calls from United Healthcare, Aetna, Humana, Cigna, WellCare, and Elevance, which was formerly Anthem. We did this to gain some insights into their strategies and outlook for 2025. One recurring theme across these calls is their focus on the margin over membership. This mantra emphasizes that insurance companies are looking at 2025 and they are prioritizing profit margins over sheer enrollment numbers.
Obviously, we need to if we want to make a profit.
While growing membership is still important, insurance companies want to ensure that they are also financially sustainable and profitable. Here is what the executive vice president and president at Aetna/CVS said during their Q1 earnings call with investors.
And again, the ultimate goal is membership stability, but we're going to favor margin over membership for next year.
This was reiterated during their Bank of America healthcare conference.
The goal for next year is margin over membership.
Now, Aetna was not alone when it comes to talking about margin over membership. You can hear this straight from the president and COO of Humana during their earnings call as well.
I also want to reiterate that we're committed to pricing discipline and margin recovery in this bid cycle.
Why does this matter to you, though, the consumer? Well, when a company says it needs to increase its profit margins, they're basically saying we need to raise our bids to lower our medical loss ratio, and they need to more accurately reflect the cost that they're spending on medical services for you, the member. This can lead to higher out-of-pocket costs and reduced benefits for you. Now, it is really no surprise that CVS/Aetna has placed more emphasis on their margins during earnings calls, since some analysts have estimated that Aetna's Medicare Advantage business currently has margins of -3% to -4%. And you really don't have to be a financial analyst to understand that is not sustainable. If you do want to see more of the details about the financials behind some of the largest Medicare Advantage companies, we recommend you take a look at the analysis from Telos Actuarial to get an idea of which companies may see negative impacts going into 2025. In addition to some companies being straightforward about their willingness to focus on profits, they also made it clear they are willing to remove plans from unprofitable markets. During the Bank of America Healthcare Conference, Aetna stated the following.
And to the extent that we can't make enough progress, we will either refile new products, so we'll pull an existing product and refile a new one, or we will simply exit a market.
Now, Humana also echoed similar ideas when they talked about the possibility of exiting different counties.
As we've said all along, we are anticipating net membership declines for 2025, largely because we do intend to exit certain plans and counties.
Additionally, Blue Cross of Kansas City, they have already announced that they plan to exit the Medicare Advantage market at the end of 2024, citing regulatory demands and financial pressures. So while executives can sit there and say, we could lose 10% of people, and that's okay, in reality, that's hundreds of thousands of real people impacted by this. However, for some positive news, if you find yourself in a situation where your Medicare Advantage plan is leaving your county and leaving you without coverage, you may have the opportunity to enroll in a Medigap plan without health questions using guaranteed issue rights. This can be a significant benefit for those of you who have previously been unable to qualify for Medigap plans due to pre-existing conditions. So please make sure to reach out to a broker if you find that your Medicare Advantage plan is no longer being offered in your county. Despite the challenges ahead, most insurance companies did express confidence in the future of the Medicare Advantage market due to bipartisan support and their growing popularity among Medicare enrollees. They acknowledge the need for adjustments and strategic changes, but overall, they believe in the continued growth and sustainability of these plans. They also feel that the Medicare Supplement and Part D market will face even greater struggles compared to Medicare Advantage plans going forward, which you can see here by Aetna's statement.
As we think about those seniors that are currently, in the market to purchase a bundle, that the cost of that bundle is going to rise pretty dramatically for them, which may, even with a less robust set of benefits, make Medicare Advantage an attractive option in 2025.
Again, we will link to the full transcripts for each of these earning calls in the description of this video. If you do want to hear about the Medicare Advantage company's thoughts about high utilization, Part D changes from the Inflation Reduction Act, and the importance of star ratings, make sure to check those out. Now that we've discussed the upcoming changes to the Medicare Advantage market going into next year, as well as what insurance companies are saying about them, we will round things out by giving our personal thoughts and predictions on the Medicare Advantage market as we head into 2025. Keep in mind that the official details are not released until October 1st, and these are just our opinions based on what we have researched and from our time as independent brokers for many years. So prediction number 1, zero premium Advantage plans, they are not going to disappear. In our opinion, one of the main selling points of Medicare Advantage plans is the fact that they often offer a plan for $0 per month in addition to what you pay for Medicare Part B. This is what you see heavily advertised, and it's what many people want to know about when they think about Medicare Advantage. We feel companies would rather forego some extra benefits or raise some copays versus raising monthly premiums. This does not mean that the percentage of plans offered for zero premiums won't fluctuate, but we would be shocked to not see a decent number of zero premium plans still available in different markets. Currently, in 2024, 66% of plans charge $0 per month in addition to the Part B premium, but we do acknowledge that if there's less zero premium plans, this will be felt more in rural counties, as we will highlight shortly. So prediction number 2, this one is less of a prediction and it's just more of a statement on the current state of Medicare Advantage plans and their finances. We believe Medicare Advantage plans, they're not as financially vulnerable as they like to make it seem. The 2024 MedPAC Medicare Advantage report, again, it states that Medicare spends $83 billion, or 22% more for Medicare Advantage enrollees than they would if these beneficiaries were enrolled in original Medicare. Additionally, according to KFF, insurance companies, they earn much higher gross margins for Medicare Advantage plans compared to other types of insurance. Also, there are dramatic headlines saying that Aetna could lose up to 10% of their membership, but if we simply take a step back and we look at their big picture, from 2023 to 2024, Aetna grew their Medicare Advantage membership by 24%. So if this 10% drop does end up happening, this is still a 5.64% yearly growth in membership for Aetna. Again, members like yourself would be harmed in this situation, but the executives and the stockholders will be just fine with these overall growths loss in membership. Lastly, if some companies like Aetna and Humana pull back from the market as they have indicated, other companies will likely step up to the plate to gain market share. According to Healthcare Dive, some analysts feel that United Healthcare is in a good position to benefit from Aetna and Humana's misfortunes. Again, UHC, they reported that utilization numbers were in line with what they expected, and their CFO states they are comfortable with their 2024 plans and they plan to build competitive offerings in 2025. Now moving to prediction number 3, we do think extra benefits will likely be reduced and some plans may exit certain counties just like they indicated in their calls. We expect this to have a more significant negative impact on beneficiaries in rural counties with fewer Medicare Advantage plans that are available. If we look at this map from KFF, in counties with 50 or more plans, the exit of a few plans will still leave many people with many options. However, there are many counties with 10 or fewer plans where the exit of just a couple plans could be substantial. Also, in some rural areas, hospital systems, they might only accept 1 or 2 Medicare Advantage plans in their network. So again, the exit of just 1 or 2 plans could have a major impact. Now, as for the reduction of benefits, we predict that the supplemental benefits like flex cards, grocery benefits, and over-the-counter benefits are probably more likely to be reduced because they do not impact what is called the total beneficiary cost, like the premiums and the copays of a plan do.
Those are some of the things that have been challenging for us as we think about 2023. OTC and flex cards, the fitness benefit, transportation benefits, all of these things will be on the table.
Now, these total beneficiary costs, they're often mentioned in earnings calls, and if companies change these benefits by more than a certain threshold, CMS can deny their bid or scrutinize it more closely. For more details about these TBCs, we will link to a much more detailed document in the description. In addition to cost cutting by reducing benefits, plans may also try to use prior authorization when possible to reduce members' healthcare usage. Like always, you need to be aware of prior authorization implications of a Medicare Advantage plan if you want to enroll in one, but we've talked about that much more in other videos and we will continue talking about it in the future. Now, prediction number 4 is Medicare Advantage enrollment will still likely grow in relation to Medicare supplements and Part D coverage. Medicare Advantage plans, again, they already make up more than 50% of enrollments for Medicare beneficiaries. This is projected to go as high as 60% by 2028, and we do agree with this assessment. Now, before we get angry comments because we've said something nice about Medicare Advantage, if you watch our other videos, you know we present the pros and cons of both Medicare Advantage and Medigap plans. The main reason we feel that Medicare Advantage plans will continue to grow is because the 2025 impacts on the Medigap and the Part D market will likely be even greater than the Medicare Advantage market. So although Medicare Advantage plans will likely get worse, they will still be more attractive for many people when it comes to comparing both options. During their earnings call, Humana mentioned that Medicare Advantage plans, their value proposition still will be greater than it was 3 to 4 years ago, but a little lesser than today.
We've done a significant amount of analysis around where the value proposition is today, where it was 3-4 years ago, and what we see is that the value proposition still will be greater than it was 3 or 4 years ago. A little lesser than today, but we feel confident that we'll see the growth there.
It's really not as dramatic as everyone's making it sound. We will link to studies from the Kaiser Family Foundation showing the details of the overall Medicare Advantage landscape in 2024 versus 2020, just to show you the maximum difference in those last 4 years, and then you can see what benefits did actually look like back in 2020. And again, here is a chart that we put together comparing some of these details. As you can see, Medicare Advantage plans a few years ago were still compelling for many people. So what can you do? First, you should of course take a look at your annual notice of change that is mailed to you by your plan by the end of September. We know this is easy to throw away with other junk mail.
Stupid junk mail.
But it is extra important this year that you at least look at it. This document will give you an overview of your plan's changes, and in addition to looking at these plan changes, make sure to connect with your broker or another broker to discuss if there are better options for you going into 2025. If you do need to find a broker, we have a link below so you can do that. Remember, Medicare Advantage plans, they are yearly contracts, so coverage changes are always inevitable, not just going into 2025, but every single year. When you do sign up for a Medicare Advantage plans, you have to start with the fundamentals. Make sure you check provider networks, medical cost, drug coverage, and more, and then you can look at extra benefits, but don't go chasing extra benefits that will only inevitably change in the future.